Well, here goes. I'm Dr. Howard Booz from Booz Chiropractic Spine Tulsa, and I have wanted to share via this YouTube type recording for the longest time. I bought the equipment, I had every intention to do it, but something always came up. You know, it's like I wanted to do it perfect, and so I didn't have a particular thing that I needed, or the time wasn't right, or some thing got my way. And I heard a quote. The quote said, "Perfect is the enemy of good." I thought, what does that mean? Perfect is the enemy of good. But it basically means that if you try to do something perfect, so often you're not going to do it. And so nothing good ever shows up at all because you're trying to do it perfect. So I promise you that these will not be perfect, okay? These are going to just be my way of sharing some information that I think is very empowering. It's been empowering in my life. It's been empowering in the lives of my patients. And so I want you to be able to benefit from these things I want to share that I know work. And again, it's something I can't share in the office because I know people are waiting, and I want to share it with you that you can also maybe refer back to if you ever want to come back and see what it is we do. Maybe I'm going to share something that, like I'm going to today. It's something that's going to help you hold your adjustments if you're a chiropractic patient. And if you're not, I'm telling you, you're missing the boat. Two, it's going to allow you to save more healthcare dollars. Really will. Three, it's going to have you have less aches and pains, and you're going to get rid of some things you didn't even know you could get rid of with something so easy and free to do. You know, the thing I'm referring to is a condition known as forward head syndrome. And forward head syndrome, or anterior head syndrome, anterior meaning forward, is when somebody walks around with their head out in front of their body. It kind of pretty much causes their shoulders to stoop as well, because the head's out in front of the body, the ears aren't above their shoulders like they should be, and puts you in a weak state because you're almost falling forward, and you're unstable, and you feel that way, and so when you do that, you know, your head weighs about 10 pounds, 10 to 12 pounds. Some of us have bigger heads than others, different story. But I have in my office this bowling ball that I have people take and put against their chest. And they put it against their chest and say, I ask them, can you hold that there? And they say, yeah, it's not that bad. They can hold it right there. I say, okay, good. Now take that same bowling ball and put it out in front of you. It's like all of a sudden, wow, it's not that easy to do. They can hang on to it for a while, but after a while, it does get harder to do, not just in their shoulders, but now it starts to tug on their low back. The same thing is true with your head. If your posture is such that it's not balanced with equal weight distribution, then you're going to start having trouble because muscles that aren't designed to hold your head back are trying to do just that, hold your head back, and they're going to fatigue. They're going to begin to they're going to begin to fail eventually, and you're going to begin to have the bones in your spine, the disc in your spine begin to have trouble. So they're going to begin to go forward. It's going to begin to pull forward. It's going to cause a shearing effect over time on your disc. And there was a study that was done at the Mayo Clinic that said that forward head syndrome can cause low back pain, herniated disc, headaches, neck problems, problems in your arms and your hands. It can cause frozen shoulder. We're going to talk about frozen shoulder here in just a second. All these just because your head is out in front of your body a little ways. Every inch your head is forward, adds about 10 more pounds to how your head is experienced to your body. So if you're balanced, it's a 10-pound head, and it's positioned, and the whole body is sharing the load of the weight of the head. But if you're forward, now all of a sudden it weighs about 20 pounds, if even more forward, 30 pounds. And now your body is spending all this energy to try just to have you stand upright. All this extra energy, which makes you tired, makes you have more fatigue. You're tired quicker than you need to be. Tired in the middle of the afternoon when you shouldn't be. So I want to show you something that you can do that's going to combat this forward head syndrome. And by the way, one of the ways that we have forward head syndrome is if I were to have my phone here, is you know how people will take their phone and they'll be looking forward like this at the phone. They do this all day long. So be sure you hold your phone up like this so you're not pulling your body forward. That's one little tip. And we look at our phones so much, our whole society does, I sure do. So that's one thing, hold your phone up. But second, there's an exercise, they're called neck retractions. And this is what I want to have you do. Take your nose and just go straight back like that. Create a double chin. So you're going to go straight back. Now you're not going to go like this. You're not going to take your head and go up like that. That's not what we're looking for. No, we're taking your nose, go straight back. You're going to hold it for like about 5 seconds, 5 to 6 seconds, and then release it. And make it 10 seconds. So you're going to hold that backward retraction, hold for 10 seconds, and then release it. Now you're not going to be going, this is not an exercise that you're going to be going back and forth. You're not going to be pushing your head out, back and forth like that. That's not it at all. You're just taking your nose, going straight back, hold it for 10 seconds, and really hold it back there. And you can do this while you're driving the car. You got your hands on the steering wheel, you're sitting there in traffic, just take your head and go straight back, hold it for 10 seconds, and then release. And again, when you release, you're not pushing your head back forward again in the position it was. You're kind of, my hopes are, is you're going to bring your head back, and when you release, your head's going to kind of stay back there. That's the new norm. And eventually it will be the new norm if you continue to do this. Now, there are some conditions that preclude you from ever getting it back to normal, and that's the condition of a degenerated joint in your neck, or it could be due to what's called subluxation. And a subluxation is when one of the vertebrae in your spine is backed up and locked in that position, and it's putting a compression on the disc, and it's also irritating the surrounding nerves. So it could be pinching the nerve, or it could be tugging at the soft tissue around the spine, which could be tugging on those nerves, which would be, in essence, just, again, interfering with your nerve system. So if you're, let's say it's in the mid part of your neck, which we're talking about now, and the vertebra goes backward, well, C5 and C6, those are the nerve roots that exit the spine, that go down to your deltoid muscles, down to your arms and your hands. So you're like T1 would go down to your little finger and your ring finger, a little higher up, it goes to your thumb and your other part of your hand, and you can experience numbness. Carpal tunnel syndrome is really something I see in my office that does quite well, and it's due to these conditions of forward head syndrome. And usually underlying this is that word I use, subluxation. So the adjustments I give to my patients helps to restore that vertebra back to its normal position, unless there's all this decay that could be around the disc may preclude that. Maybe you've got some bone spurs, maybe it's been that way for so many years that it can't turn around. But I want you to know something, and you're going to hear me say this a lot, and that's that your body has a greater ability to heal than you've ever been led to believe. Ever been led to believe. So as long as you give it a chance and just take away the interferences to your body. And so I want you to do this exercise, and do this exercise. I like to see you do it twice a day. To make it easy, this is how you're going to do it. You're going to take your head again, move it straight back. Again, it's so easy. Head straight back, bring your nose straight back, hold it for 10 seconds, and you're going to do that 10 times. That'll make it easy. 10 seconds, 10 times, and do a set in the morning and a set in the afternoon. And it's so easy to do. It'll take you a minute to do in the morning, a minute to do in the afternoon, and you're done. And you're going to begin to see greater ease in your neck. When you first start doing it, when you bring your head straight back, you may hear, just like I do a little bit, hear a little bit of crepitus, it's called, popping. You'll just hear a little snack, crackle, pop, a little Rice Krispie sound up there. So give that a try. And again, legally I'm supposed to tell you, the hodgepodge about please consult your doctor but come on, we're talking about moving your head. So you shouldn't have to worry about contacting your attorney about you moving your head. So just give that a try, and give it. But by the way, when I say give it a try, I think you're going to see some good changes within about a week when you do that. And I know that I do sometimes. If I get tight, if I get busy in my practice, and I don't take time for me like I should, I'm like you. I do the same things that you do. So, but if I start doing it, I begin to see a change right away. But if you've had a body that has not received a chiropractic adjustment, you're living on pain pills, and been that way for a long time, count on doing this for at least a 2-month period. 2-month period before you see a big change. But it's something your body has to do. Your body has to be back to its default state. So work at it. Try that with me, would you? And I wanted to mention with a frozen shoulder. So many patients have come to see me and they'll have a frozen shoulder. No, it's not cold. It's not able to move it because it's in essence like it's locked, and they can't move without it. A lot of pain, a whole lot of pain, and it's known as frozen shoulder.